Skincare, and today I'm going to be bringing on Dr. Nicholas Hyde. He is a wonderful vein specialist here in the Bay Area. He's been doing treating vein issues since 1988. So he was the go-to person when I was looking into doing something. I just found him to be really interesting and knowledgeable. Hey, there you are.
There we are.
How's it going?
Good. Delighted to be here.
Oh, thank you so much for coming on. I'm Shelley from Shelley Skincare. I am an esthetician here in the city. I also have an online store, which is shelleyskincare.com. And today we're going to be having Dr. Nicholas Hyde. Why don't you explain to everybody what you do?
I'd be delighted to. We treat both elective and urgent situations, primarily with both varicose veins as well as spider veins. We also treat hand veins and chest veins. And most of my patients, probably 80%, are females between age 30 to 70. About 20% of our population are men. Typically, they primarily are concerned with varicose veins. The risk factors for venous disease are primarily three major issues. Heredity, certainly number one. If one parent or grandparent has veins, there's about a 25% chance you might get it. If both parents have it, that increases to 61%. Second risk factor is pregnancy. So if you had a sister and she had 3 kids and you only had one, there's a good chance you have more going on with your legs, just due to the back pressure of the fetus and the high circulating hormone levels of pregnancy. And number 3, which mimics some of the properties of increased intra-abdominal pressure being transferred to the pelvis and legs, is morbid obesity. So minor risk factors include knee crossing and sometimes going on birth control pill or hormone replacement therapy.
Oh, so both?
Both of those things can occasionally, in a subset of patients, cause an increased frequency of spider veins.
Oh, wow. Okay, so at what age do you start to see that? Because I know a lot of young girls probably go on around the age of 15, or I could be crazy, but that was in my generation. But 15, so when would they expect to see spider veins?
So the patients that I'm talking about specifically are having hereditary issues with veins, but within 3 to 6 months after starting the pill or starting hormone replacement therapy, they see a surge in what they have. And a lot of those patients start to see veins in areas they never had before, particularly outside of the legs. So chest, arms, back, buttocks. And if they stop, a lot of them will go back to their normal rate and frequency of vein formation.
Are you able to see the questions, or should I read it out to you?
This means that having spider and varicose veins is a medical issue, not just a cosmetic issue. I have both. I would say that the spider veins most often are just a cosmetic issue, but sometimes, especially if you have abnormal trunk veins that are no longer transporting blood to the heart and lungs, it can cause downward compression. And where those veins finish is typically the inner or outer ankle. A lot of those patients have a huge nest of spider veins in those areas as a reflection of that chronic downward congestion. And in those patients, you're absolutely right. It is a medical issue, even though at the ankle it may look just simply like a cosmetic issue.
Well, the first time that I decided to do anything about mine was when I was on a flight last year, and I even wrote a blog post about it. One of my clients had said, oh my gosh, I had the worst experience. I flew to Europe, San Francisco, and my legs just swelled up, and it was horrifying, and I had to, walk around with cankles all through Paris for 3 days. And I was like, oh, that sounds horrible. And she's like, you need compression socks. And I was like, I don't need compression socks. I'm special. So then the next time I flew, they just went like that, and I got so scared, and I ran into Boots. I just flew through London. I ran into Boots and got these, they ill-fitting compression socks and wore them religiously until I saw you, who explained everything and showed. But I was confused. I always thought that the spider veins and the varicose veins were kind of the same thing, and that they were just cosmetic. And when you saw what I had going on, you were like, oh no, we have to fix this medical problem first and then tackle the cosmetic issue.
You touched on a couple of interesting points. Number one is a good reason to wear class 2, at least 20 to 30 or 30, 40 compression stockings when you fly is because A, it will attenuate some of the leg swelling. Also, more importantly, it cuts down on the risks of clot formation. And for some reason, it seems that Europeans understand this a little bit better than Americans. And this is pre-COVID and TSA. So when blood is stagnant, as it often is in long plane rides, it tends to go from being a liquid to being a clot. And those clots, if they form in your deep vein, make you at risk for clots that can travel to your lungs and cause something called a pulmonary embolus that often can have dire circumstances. Mm-hmm. So I encourage all my patients of two things. One is I don't want to treat you, even if it's just for spider veins, if you have air travel within 7 days, because there's a small risk of clot formation associated with all our treatments. And number two, whenever you fly longer than an hour, it's a great idea to be well hydrated, walk the aisles every hour or so, or make circles with your ankles and toes, and definitely to wear compression stockings. You don't have to wear them in Hawaii, but on the plane ride there and on the plane ride back, it's a great form of preventive medicine. The second thing is your legs will feel better if they're not so swollen once you arrive in Paris. Mm-hmm. Now, as far as how we maybe differentiate spider veins from varicose veins versus this kind of in-between vein, which is kind of blue-green in color and often the size of spaghetti or linguine, is a couple of things. Spider veins, for the most part, unless they're very dense, don't cause a whole lot of symptoms, maybe itching. The blue-green veins and varicose veins absolutely can cause symptoms. I would say the biggest difference is that most blue-green veins are getting all their blood flow just from the surface. They may occasionally be an exit ramp off of a broken main trunk vein. Whereas true varicose veins, it's absolutely originating from below the surface of the skin, and it's generating big branches to the surface. And they tend to be more flesh-colored, more the size of a pinky, a thumb. Blue-green veins, if they are causing pain, it tends to be right over the vein itself. But when I see true varicose vein patients, their whole leg tends to feel tired, achy, throbby, absolutely feels better when you elevate it. And unfortunately, the symptoms tend to come back the next day when you put your feet back down and you're walking around by late afternoon. Those qualities are very unique to varicose vein-related pain. And so when patients call us up and they go, oh, I have horrible pain on the outside of my thigh, the other thing I would say is when you're treating varicose veins, you really do need to start the root cause if the trunk is generating branches to the surface. If all you do is keep picking off the branches on the surface, that main trunk, which is broken, will keep generating branches to the surface the rest of your life. And the way we discover that is to do an ultrasound screening. It's unfortunate, not intuitive, to just guess. And if you guess wrong, you're not going to get very good results no matter who's treating you. A vein specialist, a vascular surgeon, a dermatologist, a donut maker.
What is the name of the ultrasound treatment that people should ask for?
They want something called a duplex ultrasound. And it's not really looking for the presence or absence of clot, which is important. It's also looking if the direction of blood flow in your deep system, in your superficial veins just below the surface, are contributing to anything we see on the surface. The more modern treatments are trying to get veins to close, and the body sort of interprets a vein that is scarred down and no longer transporting blood as functionless and will digest it over several months if it stays closed. Typically, patients with varicose veins notice within a week or two their legs feel a lot better, there's less swelling. The cosmetic results, if the veins do remain closed, takes about 2 to 4 months to be achieved. What's somewhat misleading is when we treat the spider veins right after the injection, it looks gone to the naked eye transiently. But all you're initially seeing is the emptying of the vein with a clear liquid into the naked eye. These thin structures look gone. The next day, the wall of the vein is still there, but it will fade over 6 to 8 weeks typically. So if you blindly treat what's on the surface, and there is something that is contributing to what's on the surface, it may reopen and worsen what's on the surface. And that's why at Elite Vein Specialists, we always do a brief initial screening to make sure there's nothing below the surface that's going to mess up the work that we do on the surface. And unfortunately, a lot of what I clean up in some patients is they went to a general dermatologist who maybe doesn't devote his practice to this. He's what we call a dabbler. And the patients come in with the following story. Surface lasered me, he injected a couple of veins, and 3 months later, it looks worse, not better. Most of this could have been avoided had they done a screening that showed that either adjacent veins or veins under the surface were contributing to what we saw.
What kind of doctor would be a dabbler? Like your dermatologist or?
I think dermatologists, occasionally now I'm seeing obstetricians and family practice docs who think of this as another revenue source. A lot of times they'll maybe hire a nurse who used to work for a plastic surgeon. All of these people can learn to be terrific, but unfortunately there's no shortcuts. And so if you don't have great hands and devote your time to the appropriate training, it really is not going to lead to a good situation. One of the simplest ways to know, in my mind, is does the person take photos beforehand? Mm-hmm. You know, it's normal in all of us to look at your legs 2 to 4 months after the treatment. You don't really focus on what went away. You focus on what remains. You know, if you can get rid of 75 to 80%, you're doing great. But if the person never takes photos and then you look at your legs from memory, the only way to objectively know whether this person was an A, B, or a C in terms of his quality of work is to see where you started from. The other thing I would say is, unfortunately, no one can prevent future outbreaks. Sure. Thankfully, in my practice, probably 80% of the patients get new stuff slowly. And I see them once every 3 to 10 years for a touch-up, similar to going to your dentist for your yearly cleaning. This past week, I saw 2 patients I hadn't seen in 12 years.
Wow.
20% of my patients I have to see once a year because their frequency of formation is so fast, but usually it's just a half session or a single session, and they do really well. When I see patients who go to docs who don't even give them a guess about how many sessions, next thing you know, you're having 12 sessions, not so good. You really should have an idea whether they say 2 to 3 or 3 to 4. And if you don't get the results you want, you know, you talk to them about it and say, wait a minute, you told me 3 to 4 and now we're in session 11.
Right.
You want to run, maybe not walk away and say, unfortunately, you really weren't being candid with me.
Very clear. You were very clear with me. And I remember when I interviewed you for my blog post, which is the freckle.blog, for those of you just joining, you gave me the before and after pictures of some patients, and I thought they were remarkable. The first time that I ever met you, you definitely took my picture. And then in our latest, you wanted to take another set. So I think before and after pictures are the best. I like to do that with facial peels and things like that when I'm treating somebody for acne or freckling, any kind of scarring. I love to take pictures because it's true. People are like, oh, I don't know if there was a change, and then there's a huge change. But you just get used to seeing your face every day, just as you get used to seeing your legs, you know.
I think it's really rewarding that the varicose vein patients, in many respects, are more fun to treat because they get their results so much sooner, meaning that their legs feel less achy, less throbby, less heavy, that cleaning up some of the cosmetic issues is kind of the icing on the cake. Whereas a lot of patients who are looking at their legs daily with cosmetic concerns, if you get rid of 60%, they look at the other 40%. If you get rid of 80%, they look at the other 20%. And so I do try to state realistic goals. If someone comes into my facility and says, I'm so excited my legs will be perfect, I try to be as transparent and honest as possible that if I had a treatment that would make your legs perfect or that would prevent future outbreaks, I'd be delighted to offer it. But unfortunately, that doesn't exist. I think 80% improvement, which is somewhat subjective, but pictures help, is very realistic. If someone can only get rid of a third, 50%, there definitely are people who can do a lot better than that.
Yeah, I love that. I love a specialist. One of my favorite people just joined. Her name is Irene from Irene Exo Fitness. We just did an Instagram live a couple weeks back, but she teaches band exercises. And after I had some of my treatments with you, I was a little bit nervous about using the band. I did it anyway because I just love the effects. But I did want to ask you, is it safe after you've had a treatment or any time to use the bands? There's the really strong, the medium, the light, and I want to get a good workout, so I want to go for the gusto.
I'm a big fan, and with COVID and my gym closed, I went out and bought 8 resistance bands and put things on my wall, and it's a great workout, and I'm 62. It's less traumatic than free weights, and so I'm a big fan. And I don't think it's a problem to utilize these on ankles and thighs and knees for your workout. As long as you're wearing your stockings and it doesn't abrade your skin, I think it's fine.
You need to wear the compression stockings while you're doing it, if possible.
Or our sweats, our pants.
Okay.
Some people, if they do a super long 90-minute workout and they're only doing legs, might do a number on their skin, not so
Okay.
much in causing veins. But
Okay.
I'm a big fan. The fact that you can do it from your own home is terrific.
Yeah.
The only
Um,
exercise I sometimes ask patients to stay away from is if they have a real serious history of varicose veins. I think squats with heavy weights might increase your risk of additional varicose veins down the road. And I'm talking about heavy weights, not just doing squats with 10-pound dumbbells. I'm talking about squats with 150 and up on a very frequent basis. Typically,
okay.
after we provide treatment, my regimen is compression stockings for a week and walk every day for 30 minutes to minimize clotting risk, which is very rare, but I want to be as low as possible. And nothing high impact for 2 to 5 days, because if you did lots of squats and running and jogging and hot yoga, you could reopen some of the veins that we've closed. And any vein that doesn't stay closed will not end up being digested. And so that's part of our compliance that leads to better results. A lot of times I'll see patients from other practices and they'll say, he didn't even make me wear stockings. And although some people who only get surface heat lasers for spider veins on their legs don't think it's necessary, if it increases the percentage of veins that stay closed, as it takes 6 to 8 weeks for spider veins to go away, it's a great idea. Clotting risk not as big a concern if only doing surface laser treatments, which I usually recommend only for facial veins.
I do have a question about compression stockings versus socks and then measuring, because when I first looked into getting some treatments, I thought, oh, I'll just get compression stockings. And then I saw all these different sizes and things. And then when I contacted your office, they were like, oh, don't worry about it. We're just going to fit you for them because they have to be the right size. And then you gave me a stocking that goes all the way up to my mid thigh instead of under the knee. You were very specific about when to use that versus the stocking and yada yada. So can you tell us a little bit about
So
like the importance of that?
I'd be delighted. So we want class 2 medical compression grade stockings. And graduated compression, 20 to 30 means 30 at the ankle, 25 at the mid calf, and 20 at the thigh. That differential helps to push blood back up toward your heart, which is how it helps with swelling and keeping deep vein flow moving as opposed to being static. Now, at our meetings about 7 years ago, someone presented a paper looking at various brands on a robot model of a leg where they had pressure sensors. And unfortunately, a lot of the brands were doing nothing or doing the opposite, driving flow into your foot. And so because the risk of clot is rare, but we can minimize it by wearing the correct stockings, I'm kind of a stickler for good, decent quality, properly measured compression stockings. Now, some patients show up with workout compression stockings, which really aren't designed for sclerotherapy, but help in one way. And that is they were originally designed for athletes to try to see if this compression gear, by pushing out anaerobic metabolites after exercise, would either A, improve performance, or B, improve recovery. It did nothing to improve performance, but they do help with recovery. And so elite athletes and even the daily middle-aged person who works out can benefit by wearing them after a rigorous workout. But in terms of being appropriate for compression after sclerotherapy or vein ablation, you really do want to get the appropriate stocking. And most of those are thigh high. Now, once we fix veins that originate at the groin and are causing varicose veins, then you can go back to knee highs if you want to wear them for prevention of clots during air travel, etc. Now, the proper way to measure isn't your height and weight. It's the circumference of your ankle. It's the circumference of your calf in the thickest region. It's the circumference of your thigh, about 2 inches below your gluteal fold. And it's the length of your leg. And so one of the reasons the better stockings fit you better is they often come in 16 different sizes. So if you buy something online for $30 and they say pick your height and weight, there's an excellent chance they'll be awful in terms of doing what you need them to do.
Yeah, the ones from Boots that I was mentioning earlier were horrific.
2 brands, and I don't own them, or that have been consistently good performers for me, meaning they last, they're comfortable, they're breathable. The cheaper bands tend to be very stiff, are Sigvaris and Juzo, Juzo. You can get them online. You can probably save a little money if you do that. Just make sure you get properly measured.
Okay, I'll put those in my notes after this is over. I'll write down those names. So I just enjoy my visits so much. And the last time I was there, you were talking about this mushroom thing that you did, like just in your personal life. You have this hobby of growing mushrooms. And I just wanted to have people get a little sense of who you are.
I certainly enjoy talking to my patients, and the added benefit is I learn stuff, and it also keeps their mind off the little needles that are going in very, very shallow. I will say, in general, not only because I have steady hands, the injection treatment as opposed to surface laser treatment is way less painful in skilled hands. In the old days, people used to inject something called hypertonic saline, and it burned like hell. So you had the pain of the solution and the pain of the needle. I would say most patients say it's a 1 or a 2 in terms of the discomfort. And typically you have mild aching for only 24 hours. My greatest passions outside of working out when I'm not doing medicine include bread baking. And I was reading somewhere about this bread that had Asiago and mushrooms in it. And the guy said in his note, this is about 2 years ago, I grew them myself. So I was like, you can do that? So I went online and I found this company. You don't buy, you find people who cut down trees, and you get fresh hardwood oak, drill holes, and you put these spores, which are inoculated into little pieces of wood like a dowel, into the logs. And once every 6 months you soak them, and then they start to fruit. Every 6 months to a year, you get a harvest, really, really fresh, delicious. I grew shiitakes. Doing hen of the woods, they haven't fruited yet, but I'll let you know. One of my other patients who's a cook said that now they have people who seem to be able to farm truffles.
Oh my gosh, can you please grow some truffles? I need to learn how to do that.
And I
I
don't know how
love
true
truffles.
or easy it is, but I'll bet you it's a big money maker.
Oh, are you kidding? Oh, I just love truffles. Hold up. This is what Dr. Hyde grew. I mean, isn't that cool? I want to
And we just cut them off, and then in 6 months, I'll bang it on a rock, put it in water for 24 hours, and then we'll have another fruiting within 3 to 14 days afterward. As long
try.
as you maintain the integrity of the bark so that other organisms or mushrooms don't invade it, you can get a lot of years for all your efforts to prepare everything.
Could be also an interesting gift to give someone. Like, I have a good friend who loves mushrooms, and that would be a really cool, like, wedding gift for her or something.
I think they do sell little versions of what I did. I did 10 logs, 5 with hen of the woods, 5 of shiitakes, and those logs were 4 feet long. I've seen little gift baskets that are about, a foot long, and they come gift wrapped. Some people even put them in bags with wood shavings because they blossom more quickly, which I think is what commercial mushroom growers do, and they tend to grow within 3 months. And so I think gifts are out there.
Oh, Irene's asking, what is your fitness routine? Because she wants to know any recommendations for men in their 60s. She works with women, but she's always learning.
My routine, because my knees hurt a little bit when I run, is I do my Peloton bike for 30 to 60 minutes 4 times a week. And then I do yoga twice a week. I used to do it at a club, but now through the Peloton app, I do yoga with my wife twice a week. And then
Nice.
I do the resistance bands about 3 times a week. And I just try to alternate body parts. I'll do chest and shoulders one day, back and legs another, and then arms another day. And I'm surprised how many exercises you can do with just those resistance bands. But as I've aged, the resistance training is actually better at maintaining your metabolism than just doing aerobic stuff to try to keep your weight down. And
Oh,
also,
yeah.
my wife says it helps maintain bone density, resistance
Oh,
training. Now,
sure.
not everyone has lots of dumbbells at their house, but these resistance bands, very convenient, very small footprint in your room or your study or your basement.
Irene does a lot of those on her channel. She has a YouTube channel.
I will
So
check it out.
I'll share it with everybody in the bottom. All right, I think we're good. So I'll just remind everybody, I will put everything in the description box below. My website is shelleyskincare.com. I'm going to put all of your information, your contact information below, but I just want to tell everyone about your 2 office locations.
First thing I would say is that obviously both of my offices are practicing all the precautions to be safe, and I'm thankful that I have not had a single patient who's become COVID positive. You only see one patient at a time. There's never two people in the holding area. Anyone who has any type of symptoms or recent travel with exposure risk, we have them wait 2 weeks before showing up. Everyone in the office wear masks. We take your temperature upon arrival. We encourage you, even if you have to cancel at the last minute because you think you may have been exposed or have a symptom, it's never a problem. That's a huge change for us. Because I'm not hospital-based, I also think that's why my risks are so much lower. And knock on wood, hopefully it stays that way. A lot of the treatments we do can be done safely. You know, some of my friends who are dentists, real challenges with maintaining being away from face and mouth and secretions, etc. Even in the asymptomatic patients, if you're wearing a mask and I'm wearing a mask, the risk is extremely low. That being said, we have an office in Walnut Creek off of Ignacio Valley Road, close but not next to John Muir Medical Center, and we have lots of parking. And then we're located in San Francisco, right off of Union Square on Post Street at 490 Post. And we share an office with a great dermatology group on the 7th floor, Suite 700. They have parking in the building on Mason, and a lot of my patients walk from BART or park at the Sutter Stockton garage.
It's very convenient.
And we do run on time. I always say to my patients, your time is as valuable as mine. I hate those offices where you have an appointment and 45 minutes later, you still haven't seen the physician.
Me too. You've never been late. I appreciate it.
3R, hopefully post-COVID, that will never be us.
Yeah. All right. Well, thank you, everyone. Thanks so much for joining and for staying with us. I'll put everything in the IGTV. And Dr. Hyde, thank you so much for all your time. I really appreciate you jumping on here with me. I'm also going to direct them to the blog post that I wrote. I interviewed you for. So thank you so much, everyone. Stay safe and hope to see you back here soon. Ciao.
You as well. My pleasure. Ciao.